Hello, everyone. My name is Kevin Henry. I'm the editor-in-chief for drbicuspid.com. Thank you so much for joining us for the drbicuspid.com podcast. Really excited to have a great conversation coming up today with Dr. Maria Ryan, who's the Chief Clinical Officer and Executive Vice President for Colgate-Palmolive. Dr. Ryan, how are you today?
I'm great, Kevin, and thank you so much for having me on your podcast.
I'm excited to have you on today. I think today's topic is really important, especially knowing that we're getting to the end of the year, the holidays, a very stressful time, shall we say. But before we dive into our topic, I'd love for our audience to notice a little bit more about you.
Sure. Well, I'm a periodontist, and I practiced for 20 years and a former academician. I taught for 20 years at Stony Brook University before moving on to Colgate-Palmolive, where I oversee all of our clinical work. We do about 150 clinical studies a year, not only in our oral care space, but also our skin health space. And in addition, I oversee our knowledge management team, which uses all those clinicals to support our claims on our products, which is very important that they're supported by good clinical research. And our scientific communications team, because Kevin, if you develop the best thing since sliced bread, and nobody understands why it's so good and the science behind it and how it makes a difference to us as practitioners and to our patients, then they're probably not going to use it. So we publish all of our research through our scientific communications department.
Well, on behalf of all the dentists and dental team members who are listening to us, thank you for that science, because I know it's trusted, and I know it also helps so much every day in the dental practice. So it's fantastic to have you on. I'm excited today to talk about a subject that I know you're very passionate about, and that is the link between oral health and mental health. And I know so often we talk about the oral systemic link and all the links that there are between periodontal disease and how it can impact the rest of the body. But I want to talk today a little bit about the psychological side of things and how we know oral health can impact people's stress level, embarrassment, things like that. So what is the main message that you'd like to get across to dental professionals whenever it comes to this oral health and mental health link, especially as we head into the end of the year?
Yeah, it's interesting when you think about the connections between oral health and mental health. Here at Colgate, we actually conducted a 12-country study that links oral health to mental well-being. And we found that, chronic tooth pain and discomfort can lead to worry, anxiety, and sadness, particularly if you think about kids who suffer from caries, the most common disease in children. And this impacts their parents as well. I mean, when you have a child who's suffering from tooth pain, and then, of course, adults themselves also have issues with pain and discomfort and loss of teeth that can cause, as you said, embarrassment and even their ability to interview for a job and get a job. I mean, we just recently published a report through the World Economic Forum, which talks about the economic rationale for a global commitment to invest in oral health. And it talks about missed days at work and lack of productivity, missed days of school, and its impact on children. So certainly, the CDC talks about the most common reason for children missing school is related to tooth discomfort. And that really leads to isolation and hinders their education and impacts their social development.
So we know the dental professional's responsibility with helping repair those smiles and to get people back to good oral health. But what about the communication side of things? How do we talk to our patients about this whenever we know it's a sensitive subject for so many, whether that be just the overall how they feel about themselves versus maybe the cost of having what is needed done as well?
Yeah, it's very interesting, Kevin. I think, as you mentioned, oral health literacy in general is low. So a lot of people don't even understand the common diseases that they face and the fact that if they don't manage them, it can not only impact their oral appearance, their oral health, but also their systemic health, right? So we put together a website with a short quiz called www.knowyouroq.com, like
Uh,
you know your IQ or your EQ. And an interesting thing about it is, it talks about these diseases, oral diseases that people face. It talks about the connections between oral health and overall health. It talks about the signs and symptoms of disease and preventive strategies and the need to see the dentist. And one of the things that was very interesting is one of the questions of the 10 questions they take to know their oral health quotient, like, your IQ or your EQ, right? So how well did you do? Is the connection between oral health and mental health.
uh,
And we often, as dentists, don't talk about it, right? Yet the question that people got right the most was that question. We thought people would say, oh, they know that caries is a disease. Most people didn't even know that caries is a disease.
uh,
They would know the connections between oral health and diabetes or cardiovascular disease. Not so much. Oral health and mental health, everybody said yes. So I think it's us that we don't recognize that people's mental health is impacted by their oral health. They're telling us it is. And if you look at many studies, it will talk about, you know, that people actually do feel there is this connection, but we don't read a lot of these studies. So that's why we have to continue to support them. So I think we do have to have these discussions. We do have to understand the medications people are taking. Many of the medications that they take can really impact their oral health. And people need to understand that. So, antidepressants, anti-anxiety drugs, they can cause dry mouth. As you said, anxiety can cause bruxism and the need for making mouth guards, the need for using fluoride treatments in people who have bulimia or constantly and wearing down their teeth. And so I think there are things that we can do to help people, but we have to have those conversations to really understand the impact of their mental health on their oral health and the impact of their oral health on their mental health. It's a two-way street.
it's a great point. It absolutely is. And I want to bring up a little bit of a touchy subject if I can, and that's eating disorders. And I know that that is something that is very common in our country, around the world. And I don't think that there is that connection made, as you were pointing out a moment ago, between the effects of eating disorders on oral health. And again, I asked the question, is that something that the dental community should be making discussions about and really bringing up in topic whenever that patient comes into the practice and they suspect that could be an issue?
Yeah, I mean, it is I think an absolute must. And certainly, bulimia we know can cause significant erosion. But even people who are not getting the proper nutrition, they will have, issues with oral health. Calcium is important. Many vitamins and minerals are important for, good periodontal health. And if their nutrition is not good, it will impact their oral health. And so we need to have those discussions. And I can tell you a funny story. So, you know, I actually started feeling that my teeth were very gritty and they were just not the same, no matter how much. And, we're dentists, so our hygiene's pretty good. And so I remember going in and seeing a friend of mine, and I had such bad erosion. And the first thing that I was asked was, Maria, are you bulimic? And I was so happy the person asked me. I'm not bulimic, but I said, look at me, I'm not skinny, but it was from GERD, right? So
Oh,
even, other conditions will allow for the acidity to come up and you get the same kind of symptoms. So, and that needs to be addressed. Like for me, I had to take medication that helped with GERD. But for someone who's bulimic, they really need to see a mental health provider to help them through that. I don't think that's our job, Kevin, as dentists, but certainly it's our job to say, hey, do you have a problem? And I was not upset that the person asked me.
no.
And I think that it would be appropriate for us to say, this is really not healthy for you. There are better ways to do this. if you want to lose weight or if there are mental health issues that are driving this. And you need to see your physician because I'm seeing the oral signs of this. And we
Mhm.
can try to address this for you, but unless you stop doing this, it's not going to get better.
So I'm going to ask you to put on your dentist hat for just a minute and ask the role of the dental team in having these conversations and maybe making sure that you and the team are both on the same page when it comes to these types of conversations as well.
Yeah, it is. I'll give you another story. Having practiced for many years, my hygienist had said to me, this person's perio, just from last time to this time, it's gone down significantly. I said, okay, I'm coming over to take a look and let's, find out. I said, do they think they're diabetic? There are many reasons that you can have very aggressive perio. And so she said, I asked all the typical questions, and the answer was no. So I remember going over and I sat down with the patient and I looked, and it was dramatic changes. And you could tell that the person was very anxious. And, as we were having the conversation, this woman looked like she was about to cry. And I said, is there anything else going on in your life? And she said, I'm going through a divorce. And she started talking about this. And I think, depression, anxiety, there are a lot of studies that show that that can actually increase your risk for periodontal disease. And so, if you look at tooth loss studies, there are several studies that talk about people who are suffering from mental illness being, 2.7 times more likely to lose all of their teeth and
Uh,
become edentulous. And this was published in the Canadian Journal of Psychiatry. So it is a fact that, that type of depression and anxiety can really drive oral diseases. And so, we got into a discussion about how she needed to, manage this and maybe needed to seek professional help because if it's that bad that it's showing up in the oral cavity, the person needs some help in managing the mental health issues. And you would think that's a difficult discussion in the dental office, but she got up and hugged the hygienist, hugged me, thanked us for having the conversation. So it shouldn't be. We're healthcare providers. And we have to think about all the health issues that our patients face, including mental health issues, and we shouldn't shy away from it in having those discussions.
And I think the timing of this conversation is so important, excuse me, because we are coming up on the holidays and we know while it can be a time of joy, for some it can also be a time of depression. It can be a sad time as well. And I love the fact that you all saw a sign in a patient that opened up a conversation. And
Right,
again, I'm
right.
sure this patient didn't mind opening up to you. It sounds like that was a welcome relief for her to be able to do that.
Yes. And I think one of the other things we face in dentistry, Kevin, is that a lot of people have phobias of the
Yeah,
dentist,
true.
which is a mental health issue. And sometimes you have people who come in until the pain is so severe and things are so bad. And you say to them, why did you wait so long? And they'll say, because I was afraid.
Uh,
And so we need to manage that as well. And sometimes there are things we can do as practitioners to help manage those dental phobias, but also sometimes they need professional help from, the medical side. And together we need to manage that because if someone's not getting their dental treatments because they're afraid, then we need to work through that as well.
It's a great point. And another side of mental health there as well, for
Yes.
sure, is to eliminate that phobia where we can. So, Dr. Ryan, I know you mentioned the website earlier. We're going to make sure to have that in the show notes as well as in the article here on drbicuspid.com. But I wanted to make sure, are there any other links or websites that you want to make sure our audience knows about whenever it comes to this topic of oral health and mental health?
I would say for sure, I'd love for people to see this article that was put out by the World Economic Forum.
Yep.
And that is on the World Economic Forum site. And what's very interesting about it is that when you think about what is the World Economic Forum, it's businesses from all over the world. And so they put forward, and we sit on their global health equity network, and they put forward a plan to CEOs all over the country for improved health to help the economy of the world and to help their employees and the communities that they serve. And nowhere in it was oral health. And yet they were very interested in mental health and the mental well-being of their employees and the communities that they serve. So we actually developed an oral health affinity group, which put together a white paper for the World Economic Forum to talk about oral health and its impact on the global economy and its impact on overall health and well-being, including mental health and someone's ability to get a job and how that impacts people and how children missing school and what the impact of that is and the economic impact of it. And it was so educational for
Uh-huh.
so many companies that people now are looking at, are they giving their employees good oral health benefits? Are they talking to their employees about these connections between oral health and mental health and other health issues that they may face? And so I would say, take a look at it. It's an interesting report. And I think it will make a difference for us in dentistry because we really need to get the word out. And I love Dr. Bicuspid because it gets the word out not only to oral health professionals, but I know lots of others that also read it as well. So that's great.
Thank you for that. I appreciate that. And absolutely, we'll put a link to that article from the World Economic Forum into the show notes and our article on Dr. Bicuspid as well. So Dr. Maria Ryan from Colgate-Palmolive, thank you so much for joining me today and your insights. I really do appreciate it.
And thank you again, Kevin, for having me with Dr. Bicuspid.
Absolutely. Hey, we're glad to have you on, and we're glad to have all of you listen to this episode. We think it's really important to tackle these topics that sometimes can be a little taboo in the dental practice, but yet they're so important to not only the health of your patients from the mental side of things, but the oral side of things as well. Until next time, it's Kevin Henry, Editor-in-Chief for Dr. Bicuspid, signing off, and as always, wishing you nothing but success ahead.